here, the idea is what? That we are creating a replica of any physical device. The replica doesn't mean any kind of theoretical model or mathematical model. Replica means it having the same thing, right? But where from the replica will get the data? That's why you need IoT, right? By using sensor, we collecting data and trying to simulate the entire physical thing in a concept called digital twin. Correct what I'm saying? Is this clear? So then why we require digital twin technology? The first reason is the personalized and precision medicine. What is that? Let's say one cancer patient, right? So what do you do generally? What doctor generally do? With the set the dose for chemotherapy. As you know, the chemotherapy is not good for health, right? So hair losses and then another stomach upset, so there are many things will happen after chemotherapy. Then what you can do, if you have a digital twin of the entire cancer patient, we can study on that digital twin that if I have this amount of dose, right, then what are the side effects will come. I mean, clear what I am saying? So if you have an entire digital twin of your human body, you can experiment on that and then you physically apply the dose. That is the first one is called personalized and the precision medicine. That is the first advantage of why we need digital twin. The number two, real-time monitoring and predictive analysis, or you can say the analytics. What is that? So as you know that your patient is in ICU, right? In the morning you have seen the patient is absolutely okay, but afternoon you have received a call from the hospital, dear patient is not doing good, please come immediately, and we got a message, died. Right? Because we have a monitoring system in ICU, but nobody will care about that, right? So that's why if you have a digital twin and if you have all the sensor within the body, embedded within your body, we have in the ICU, and we can predict that what will be the situation of the patient. Is there the possibility of death within 6 to 12 hours? We can predict. That is called real-time monitoring and the predictive analytics. And this data will go through as an alert to doctor, patient party, nurses, everywhere. So that is another advantage of digital twin. That if you have a twin, we can also predict something else. We can have analytics of data that what are the things may happen in future. So that is called the digital twin concept. It's basically a twin of a physical thing. So twin is very common term because, right? So that is the concept of digital. Example is digital twins are for ICU patients and then deterioration 6 to 12 hours earlier than the traditional analysis. Is clear what I am saying? So next one. Third one is the surgical planning and treatment. Already I told you that before surgery, if you can study the entire body, let's say if you have to do brain surgery, it's very complex surgery. If you have a digital twin of a brain, then you can study the entire brain, right? Occipital, then the ventricles, then the prone to a tumor places, everything you can study. And if you have a study other than the operation or surgery, then you can understand that what is the problem of this particular patient. So what are the things you can do? That is called the surgical planning and training. Next we have chronic disease management. That is another one, another important thing. The chronic disease management. Why we need this one? Let's say for diabetic patients. What happened to that? In case of diabetic patients, let's say I told you one example of the company called Twin, that you have to regularly monitor the patient statistics, okay? That when there is a sugar spike, when there is a sugar drops, and many things we have to monitor. So if you have a chronic patient, if you monitor, let's say I also gave the one example earlier that let's say in body to body it matters. Let's say if we have pizza, there will be no sugar spike for me. But if we have the pizza, your sugar spikes in high level. So that matters. So that's why when we have a chronic diabetic management or let's say disease management, so in that case, this digital twin helps you to monitor day-to-day data. So that is the thing. This is the managing diabetics through digital twin that simulates blood glucose responses to activity and insulin. Then you have the clinical trials optimization. Let's say when you have somebody have the new medicine, so there must be a clinical trial. So if we test it for a direct human body, there may be some side effects. Am I clear? Let's say you have the new medicine, so you have to have some clinical trial. So that now if we have a digital twin, we can experiment on the digital twin. That is very, and that we can have a more detail on that if we have a digital twin rather physical body. So that is another one, is called the clinical trial optimization. Number 6 is the operational efficiency in hospital. So if you have a smart bed in hospital, then you have a smart surgery equipment, robotic equipments, and if you have a digital twin of that, then you can perfectly monitor the oxygen level and everything you can monitor. Let's say entire operation is simulated in a digital twin. So that monitor the everything, whatever if you, let's say sometimes doctor may forgot to give, nurse forgot to give this one. So you can immediately monitor and everything you can analyze. So that is another advantage of operational efficiency in hospitals. So now I'll come to the emerging technologies driving digital twin in healthcare, that is AI and machine learning of course. Then you have IoT and wearables and the cloud and edge computing. So I'll discuss one after another. Okay. And then we have 3D modeling and imaging. Okay. So these are some of the technologies. Why you need a 3D modeling? Then if you have a 3D model of your body or brain, whatever, so then you can understand that in very detailed analysis. What are the things that are happening over here. So that is the main understanding. What are the challenges we have in this technology? So we have data privacy and security problem. Yes, we have to have a lot of data. If someone corrupted the data or someone mismanaged the data, so that's a big problem. As you know, the problem of IoT is identity security nowadays. And then you have some high cost issue because you have to deploy many things and approval. Let's say nobody will give you the data. In US, in Germany, they have some data privacy rules. No one are willing to give their own data, own medical data to you for experiments. So that is another issue of that. So these are some of the things I think which are very much important to understand digital. I think you must have understood the concept of what is digital. Is it clear what I'm saying? Is it clear? So now I will show you one small video and then have a live demonstration that what I have simulated the entire brain, right? So I'll show you this one. Very, very interesting.
Connected.